John Bird. I'm a student nurse at Cedar Crest College, and today I'm doing my presentation on predictors of gender-related barriers, work, and life satisfaction among men in nursing. The problem: occupational segregation. Research consistently shows men and women remain more drawn towards careers in which employs that of their own sex that represents the majority of the workforce. Also, limited available studies. When it comes to men's happiness with nursing, the studies are few and far in between. Males' overall job satisfaction in nursing. Men feel like they won't be satisfied working in a job that's dominated by females. And males' perception of promotion in nursing. Significance: more men in nursing can help with nursing shortages. Just a man becoming a nurse is just another body, which in turn will fill the position, so it will be less of a shortage. Men in nursing can help break the female nurse stereotype. So oftentimes we think of nurse right away, we think of female. So if we have more men in the hospitals working every day, then we can help to break that stereotype. Literature search was done with Cumulative Index to Nursing, which is CINAHL, that yielded 296 results. Also the Elton B. Stevens Company, or EBSCOhost, which yielded 112 results, and OVID, which yielded 162 results. The keywords used were men in nursing, males in nursing, and importance of men in nursing. There were some limitations. There was date limitations. Articles were to be from 2004 to 2013, and also they were limited to full text articles. The article I chose to critique was the predictors of gender-related barriers, work, and life satisfaction among men in nursing, and the authors of that were Aaron Rochland, Glenn Good, and Tracy Carver. The problem and purpose: men in nursing are concerned with masculinity and heterosexuality, meaning men feel they're going to be looked at as homosexual or either inferior to their male counterparts that work other jobs. Nursing is viewed as limited in power and prestige. Oftentimes males think the power and the prestigious jobs in the hospital would be a doctor, and being a nurse would be inferior. And nursing not viewed as gender appropriate. Some working class, blue collar guys just think that being a nurse is not a job that a man does. Research. The research done for this study was done in an online questionnaire. It used several different scales in order to judge the overall satisfaction. The scales are gender role conflict scale, which assesses dimensions of masculine role conflict with other, which occur with rigid, sexist, or restrictive gender roles learned during socialization. There's also the multi-dimensional scale of perceived social support, which is designed to assess perceived social support among family, friends, and significant others. There's also the self-assessment of job skills, which indicate confidence in work-related skills. There was also the gender-related work barriers, which assess the degree of gender-related work barriers. There was jobs in general, which assess the overall general work satisfaction, and satisfaction with life scale, which higher scores reflecting greater life satisfaction. Study design was a cross-sectional study. Some independent variables were that they're all men and they're all nurses. Some dependent variables are experience, their specialty, and other job and overall job satisfaction. The sample size was 174 men ages 19 to 71, with 79 being Caucasian, 6.3 being Hispanic, 5.7 being Asian, 2.9 being African American, and 1.1 being Native American. Out of all those, 84% were part-time and 16% were considered to be full-time nurses. The results: 19% of men in nursing explain job satisfaction. 19% reported perceived gender-related work barriers. Also, men employed as nurses are as satisfied as other groups of men. In terms of the GRC, male nurses in this study reported mean scores that were within 0.5 standard deviation as those of sample of 308 white adult men in different jobs. Limitations. Some of the limitations that could affect the study is that most of the participants were part-time. With being at work less, your satisfaction with life might be increased because you're not at work as much compared to someone who's full-time and will be away from their family more. Also, there's problems with most of the participants were Caucasian, so it's thinking that maybe a minor the minority might have like a different feel of satisfaction. And also there's limitations in the questioning. Some questions were removed due to the fact they were too much about sexuality. They didn't want to offend anybody in order to get the proper results and get their questionnaires back. Implications. Perspectives from both genders are important to the advancement of nursing. We all know that nursing, when you're performing nursing duties, it's not just to females or males, it's to everyone from all different races and all different ethnicities as far as gender too. And even though a lot of people don't think so, male nurses are satisfied with being a nurse. They overall satisfied. Conclusion, despite certain limitations with, like we said, the race and part-time participants, the results were reliable. And also, if we just use these different scales in a later date, we can duplicate the same study and the same things can happen over again. And that's the reference page. Thank you.